In a world where health is paramount, a silent hero often goes unnoticed: the blood donor. Every day, thousands of lives are saved through the generosity of individuals who give a part of themselves to help others in need. Total Health Trust has been at the forefront of a remarkable initiative, the Blood Donor Drive, for the past 3 years. The Total Health Trust Blood Donor isn't just about collecting blood, it's about fostering a culture of giving, compassion, and community amongst its staff and the populace with the sole purpose of saving lives.
So for us as a company, we believe that we owe it as a social responsibility to ensure that society thrives. And one of the ways that society can thrive is that the health ecosystem is supported to operate optimally. One of the problems that happens in emergency care is that we do not have enough blood in our blood banks, and that occasionally also when there are emergencies, people do not know where to find them. So for us as an organization, we started last year partnering with the Lagos State Hospital Management Board. And last year we were at General Hospital Lagos. This year we are at the Lagos State Accident and Emergency Center in Ikeja. And for us, we are very particular that we need to save lives. So with the theme for the year, donating blood as well as saving lives, ensuring that we also share in that responsibility. So for us, we are happy to do this, and we hope that we can continually make this a reality.
So I've donated blood 2 times, and knowing that the act of blood donation would save someone's life has really inspired me to donate blood, and I would love to do it over and over again. During the last blood donation, there were a couple of accidents that were brought into the center, and seeing that my blood that has been donated will potentially save someone's life, it's a good feeling.
The motivating factor for us year in, year out are the feedback that we get from people, the feedback of, the hospital that we visited or that we partnered with have blood supply. The center that we give all the blood that are donated on a yearly basis to doesn't have the challenge of blood donation. Those feedback of lives are being saved are our motivating factor. For us, partnering with government-owned hospital is strategic in that they have the highest traffic in terms of people accessing health care. And they also have the challenge of blood provision. So looking at it, we decided as an organization that it's best we give back the blood collected at these voluntary blood donation exercises to this hospital. Our first year, we decided to partner with General Hospital Marina Odon. Why? That was the first general hospital in Nigeria and the first in Lagos. The traffic to that particular center is huge, it's enormous. So we felt the impact of giving them the voluntary blood that are donated by our staff, by people from the public, is important. The following year, we decided to also give back to another center that is critical. And when I say critical, Lagos State Accident and Emergency Center is a critical point. That's the first point where you have victims of accidents on the express along Lagos-Ibadan Express Road within Lagos State. That's the first point of call when there are emergencies, accidents, fire, building collapses, and things like that. The victims are taken to that hospital. So we felt that center, we feel the impact of the blood that we donate to them.
Behind the scenes, a dedicated team of healthcare professionals ensures that every donation is handled with the utmost care and professionalism. Total Health Trust has had the privilege of working with capable hands who provide relentless medical support for every blood donation drive. From the moment a donor walks into the center to when their blood is processed and distributed, every step is meticulously managed to maintain the highest safety and quality standards.
A typical day in the Lagos State Accident and Emergency is like this. We just get to work in the morning, everybody, optimistic to have a good day. But when there is a road traffic accident, the victims are rushed down to the Lagos State Accident and Emergency Center, and an alarm is sounded, and everybody rushes to the triage center, and we all try to see what the issue is. Now, the doctors will look at the case, and an accident case is brought into the resuscitation room after assessing the patient or the victim. And then everybody begins to do whatever they are trained to do. The nurses, the doctors, the laboratory scientists, the attendants, everybody gets busy. And so when there is a victim that needs blood, the doctor alerts the laboratory to get blood ready after assessing the patient, and they conclude that this patient will need blood. So the lab starts prepping and preparing the blood. And once the blood is ready, it's taken to them to start the treatment of the patient, the victim. It varies. Some victims may not actually need blood. An average patient or victim may need just 1 or 2. But we've had cases of victims that are really bad, and they have used up to like 12 pints of blood, even in trying to stabilize them before they are moved to another center where they will be adequately treated. Corporate social responsibility of Total Health Trust has gone a long way to help further solidarity among 2 health sectors in doing what they know how to do best. And it has helped us also as Lagos State and Accident and Emergency to save more lives by the voluntary donation they are doing. And it has also gone a long way to us, doing what we know how to do best and achieving greater results in trying to save lives of accident victims in Lagos State. We appreciate their show of solidarity, which started last year, and this year it's continuing, and we expect that it will go a long way as well to help Accident and Emergency Center in helping accident victims.
But the impact of THT'S Blood Donor Drive doesn't end at the donation centers. The blood collected through this initiative is used in hospitals and medical facilities, where it becomes a lifeline for those facing medical emergencies, surgeries, and chronic conditions.
The Lagos State Accident and Emergency Center was established in 2010 by the Lagos State government to provide 100% free emergency trauma care to victims of road traffic accidents and other injuries in the state. Since inception, we have seen close to 40,000 victims of injuries. A good chunk of them come in what we call critical situations between life and death scenarios. Even though our mortality rate has remained well over under 2%, we have still found, as it is in global trends, that about 50% of those that die because of excessive loss of blood. And this underscores the importance of blood in treating victims of emergency trauma injuries. So in LASEC, we provide blood 100% free. Average one of our patients that need blood require about 2 units of blood, but some require as much as 5. We've even had people that have taken as much as 12 units of blood. So, and we provide this blood 100% free. Even though we encourage people to donate blood, but we treat them without even them, having any relatives, having anybody to donate or to make blood available for them. So we definitely need to continue to have a continuous source of blood so that we can continue to save lives. THT has been very supportive and helpful in meeting the huge gap in the blood supply in Lagos State. Last year, our facility partnered with them, and with their support, through multiple campaigns, we're able to raise over 80 units of blood. They had some of their staff donate some blood. They supported us in campaigning around the city to encourage people to donate blood. They provided support to those that donated blood so that they're encouraged to come back again and again and again. So THT has been fantastic. They have been very supportive, and they have also helped to bridge the gap in encouraging blood donation in our city. This year, we're looking to work with them again.
This year, the blood donor has expanded with the inclusion of THT's clients, churches, and the public.
My name is Ajayi Damdare. This is my first time donating blood. The experience is not really that bad. I can see people join, telling us to come and donate, and telling us the advantages to donate blood. So I feel really, really proud donating blood today.
The reason why we do this is so important and dear to our hearts. We all know that health is wealth, first of all, and that having a good health plan helps to minimize downtime in productivity. No human being wants to be bedridden, and when they are bedridden, there are situations where they do need blood. When they need blood, we want to be there. We want to be there for them. We want to impact the communities where we operate, and this is why essentially we do this.
Well, this is actually my first time of donating blood and being part of the blood donation drive. It's been a refreshing experience. It's good to know that in our own little way we can save lives. We don't necessarily need to be a doctor to do that. In your own little way, your own little capacity, you can save lives.
I think it's a good opportunity to actually give your blood, if you do have, to other people who need it. And also it's an opportunity for us as a group to come together, to meet other people, to hear from their experiences, and to even meet people who actually have donated the blood continuously.
As THT celebrates 3 years of consistently saving lives, it remains committed to ensuring this noble endeavor. The Blood Donor Drive continues and encourages that together we embody the spirit of compassion and solidarity, enriching countless lives with every blood donation. Because when it comes to saving lives, every donation makes a difference.